Okay, so our panel is on standards for program evaluations. In other words, what are the standards of the studies, the design, measures, analyses that need to be used in order for a study to be, or a series of set of studies to be included in benefit cost analyses. And Becca Maynard is our first presenter, and she's the University Trustee Chair, Professor of Education and Social Policy at the University of Pennsylvania. Many people I know are familiar with her work on how do you design and carry out randomized controlled trials. She's done much work on that in both education and social sciences, and also a lot of work on how do you do systematic reviews of evaluations of program effectiveness. So we're in very good hands with Becca talking as our first presenter in this panel.
Hey, thank you. It's a real pleasure to be amongst this group talking about such important issues. So I'm going to talk about 4 key considerations around the question of what evidence do you include in cost effectiveness or benefit cost analysis. And the 4 themes are, one is the overall relevance of the study. How do you decide what's relevant and what's not? Second is the relevance of the particular impact estimates that are reported, because many studies have lots of different impacts in them, and some impacts may be more relevant for some studies than for others. The third, and a big one, is the causal validity of the impact estimates. There's a phrase in business which is GIGO, garbage in, garbage out, and we want to have good stuff in and good stuff out. So, I think we want to think about how do we know how good is good enough? How do we know? And the fourth is it has to do with the adequacy of reporting on impact estimates, and these are all things that have been touched upon by particularly Hank and Steve who have taken on the richest applications of these tools. So, taking the first issue, the overall relevance of the study. First, we have to think about the intervention itself. Is the intervention relevant to policy or practice decisions that are under consideration? There are very important studies that address important interventions, but they may not be relevant to today, or they may not be relevant to your setting. So, for example, if you're talking about a health intervention and it entails a set of medications or foodstuffs that need refrigeration, you need to think about whether or not the areas where you're going to potentially apply this intervention must have refrigeration, or you've got a much bigger issue on your hands. Second is the counterfactual. Sometimes we know exactly what the intervention is, and that's a very nice intervention. It's a high-quality early childhood program, or it's an immunization program, or a social and behavioral program. What's it being compared to? Because that affects how we interpret the impact estimate that we get. If you're comparing a social and emotional behavior program against a business-as-usual condition that is very similar in context, that gives you the evidence from that study is going to give you something quite different than if you were comparing the implementation of that same social emotional intervention program in a context where it's chaos in the families, it's chaos in the schools. So knowing what the counterfactual is that is underlying that study is really important to judging whether or not this is a set of impact estimates that is relevant. They may be a perfectly fine set of impact estimates, but they may not have relevance to your purpose. So this is what we're really talking about, is when do you include the evidence in your benefit cost or cost effectiveness study. Third, related to the relevance, is the context. Was the study conducted in a location and a time period that's relevant, for example? So I would argue, for example, that this is one person's judgment, I don't think the Perry Preschool study has any relevance to today. I think the world is just so different. It is not, I hail that study as one of the great impact evaluations of all time, but I don't think the results have any relevance because it was Ypsilanti, Michigan in 1964, 65, 66. the world was very different. The mothers of those children were not in the workforce. 70% of the mothers of the children are not now in the workforce. We didn't have early childhood programs then. We were just starting to even think about kindergarten as a mainstay. So there were just so many things. I mean, in general, I would argue that that often studies that were done very long ago are of limited relevance today as input to a benefit cost study, as opposed to input to basic science, for example. So it's not that the study was bad. It is it relevant to the questions that we are asking today? The settings, do the study findings pertain to a relevant setting option that you are considering? So I think Steve's point about Washington State, that's where he works. That's where WISP, they're serving that mission. The things that are relevant in Washington State may have no relevance to New Jersey or Maine or Texas for reasons that may have to do with legislation, may have to do with weather, may have to do with all kinds of things. So we need to think about this. So perfectly fine studies may not have relevance to the question that is behind the interest in a benefit cost or cost effectiveness study. So the second point I want to talk a little bit about is the relevance of impact estimates within the study. So you've got a relevant study. We've agreed that the study has relevance to the program, policy, practice problem that is under consideration. There may still be issues about the relevance of the impact estimates that are generated as part of that study. One may be, for example, the reference period for the impact estimates. So are they matched with what I think of as the investor, whoever it is that wants to consume the answer to your question? And it could be a local school board. It could be the state legislature, as in the case of WISP. It could be the local parent group. It could be the Boy Scouts of America. It could be the federal government. There are lots of different constituent groups, and a benefit cost analysis needs to be relevant to that organization, needs to speak to that, needs to sort of hone in on the benefits and costs that are of interest to that group. So there's also a question of the relevance of the particular estimates to the mission. So is this matching the programmatic or policy goals? If you are in charge of child care policy for the state, you are probably not going to be in a position to advance a program that is oriented towards crime prevention, even though that may have good child care elements, or vice versa. So different folks would be of interest. So that might be the studies may be of interest to a higher level organization, the state or the federal government, but they may not be relevant to to other organizations. So again, who's the client for the benefit cost analysis? And specific impact estimates may or may not be relevant. And my third one, this is one I think is really important. We started touching on it in the last session. I just, is this a primary or secondary outcome of the study? And what is the likelihood of selective reporting on this outcome measure? This is dicey because it's not, we don't want to be so foolish as to throw out the baby with the bathwater. So certainly if we had a drug and we had, it cured my ill, the ill I took it for, but it gave me another one that killed me. That's, I would be really sorry that I didn't look at that secondary outcome, which was not the primary reason the drug was created. On the other hand, I do worry about how many times the graduate student comes in and wants to look at the teen pregnancy effect or the crime effect or the labor market effect 20 years, 30 years later, and where are those studies that found negative or null point estimates? Because we know that there is a chance, just random chance, if we do enough of these sort of random looks at treatment control differences, we are going to find some mean differences that will show statistical significance and be, one side or the other of that zero mark just by chance. So I worry a lot about these what I call more exploratory analyses. I think we should do them. I think we should think about them. Generally, I think we should be very cautious about just throwing them in the hopper because they were estimated, and they feed our mission. I think we should think about them as informing theory, informing the next generation of research, maybe including them in a sensitivity analysis. But I think it's really a little bit risky to take something where the logic model was, and the whole intervention was about one set of objectives and outcome measures. And because we happen to have access to some other data and were able to estimate impacts on some other outcomes and found some stars after the impact estimates, I think it's risky to include those measures in the same category as the outcome measures that were front and center in the original analysis. So the causal validity of impact estimates. This is a biggie. So there are all kinds of methods that people use, and sometimes they put a great label on it, RCT, gold standard. When you look under the hood, that bore no relationship to a well-executed RCT. Sometimes we do all kinds of other methods that I think have different degrees of credibility in terms of their ability, the impact estimates that we generate from them. So one thing that is really important in judging the causal validity of the impact estimates is the method that was used for creating intervention and control groups. How were those two groups created, and how likely is it that given the way those were created, you will be able to get an unbiased estimate of the program impacts? Here, the randomized controlled trial is certainly the best of the methods for that particular purpose. Certainly, it doesn't solve all problems, but for that particular purpose, you have gained some traction there if you are able to randomize either the individuals or units of the clusters of the individuals that are getting different treatments. Second best is, some kind of matching technique, whether it's, propensity score matching or instrumental variables. Sometimes people just throw in a bunch of control variables. I think we need to think really hard about where we draw the line in these matching methods and what kinds of tests we can put into place to sort of not just take the study author's report of how these groups were formed and cite some method studies that argue that this is a good method. All methods can, under certain circumstances. Economists, we are famous for saying if the assumptions of propensity score matching are met, then you will have an unbiased estimate. If they're not met, then you likely will not. And the same with any other matching method or statistical control method that you want to make or want to adopt. So even for RCTs, we have to ask questions like, you started with a good RCT, the groups were comparable at the beginning, who are you analyzing? What subset of the original sample is in your analytic sample? Were people flipped from one group to another? Perry Preschool flipped a bunch of kids from one group to the other because the mothers couldn't be working. So they took some kids who went in the control group and they just decided to flip them over to the treatment group. So they have, if you look, they've got much different distribution of mothers working in the two groups. None of the treatment group mothers are employed So you need to know that. You need to know whether you lost sample, whether you had differential sample loss, whether the two groups still look similar at the point that you're doing the analysis. For other designs, are comparability standards met? Is there any reason have you even controlled on observables through your matching method? And if you've controlled on observables, what are the threats still to the unobservables? What are those assumptions that you are putting out there with one sentence that says, assuming all the things that propensity score matching assumes? So we really need, and then there's the analysis methods. Sometimes people get all the way down to here, okay? We've got the groups, and we know we can buy the assumptions, and then they'll do something really stupid at the analysis stage. So we need to watch for that as well. So, at this stage, oftentimes they will put in something that is not just treatment, but they'll put in something like the dose of the treatment, okay? And then they'll report the coefficient on the treatment dummy as the impact of the program. Well, you just sort of messed up that coefficient. So, you will be surprised what happens. Really smart people do sometimes really silly things. And sometimes they don't tell you. You have to dig pretty deep. So. Okay, and then fourth is the adequacy of reporting. Okay, if I could do one thing and just wave a wand, I would probably eliminate effect sizes from the universe, because we don't seem to be able to remember that an effect size is a unit of currency, and the effect size that is using as the standard deviation, the national standard deviation for a national sample of kids is not the same currency unit as an effect size that is using the sample of all kids who are in the bottom quartile or who are from low-income families or who are English language learners. So I think we need to worry a lot about the adequacy of reporting. And along with this, do we know enough to know what the intervention was, and do we have the implementation issues? So that was pretty well discussed this morning, and I think my colleagues will also talk about that. So thank you.